facilitate. So when I go to poke around, what would reverse neuromuscular inhibition? Isometric or concentric contraction? No. Eccentric contraction? No. Correctives? No. E-stem? Jury's out. So what I'm doing is I'm going to the neuromuscular junction, which is responsible for neuromuscular facilitation. So if she's inhibited because of neuromuscular physiology. Here's what you don't understand because you didn't learn this in school. You don't understand how to assess and reverse neuromuscular inhibition, which is what I'm doing on that test, which is why people are posting, well, it just looks like you're doing da-da-da-da-da. Okay, it looks like I'm doing da-da-da-da-da because you didn't learn how to apply neuromuscular physiology in school. So since then, you've been reaching for things like E-stem and correctives, which does not work. So what I'm doing is I'm going to the neuromuscular junction of the rectus fem, which I just tested, and I'm irritating the neuromuscular junction to facilitate contraction of the muscle. So I'm going to the proximal and distal muscle belly because that's where the neuromuscular junction is. That's where the muscle spindle is. That's where I'm going to go. I'm not going to the trigger point because trigger points don't exist. I'm not going to the muscle spasm. I'm not going to the painful spot. I'm not going to the origin or the insertion. I'm not going to the GTO. I'm not going to the tendon. I'm going to the neuromuscular junction in order to get to the muscle spindle, which is in the muscle belly. So once I irritate that, I go back and I retest. And guess what? Her force output increases by about 140% in 10 seconds. Now, can you do that with E-stem? No, you can't. By the time you walk across the room to get to the E-stem and walk back, I've already done more than you're going to do in the next 10 to 15 minutes. So why aren't you doing this? The reason why you're not doing this, the reason why you don't know how to assess neuromuscular facilitation versus inhibition is because you didn't learn that in school. You learned manual muscle tests, which don't tell you really anything. And you didn't learn how to apply neuromuscular physiology. So if you would have learned that, you would do the same thing that I do, and every PT across the board would be doing the same thing that I did because they would be basing their evaluation and treatment processes on science rather than 1970s old school garbage PT. So these are the things that you did not learn in school. So this is why it sounds so foreign to you when you hear me talk and see me treat, because your brain wasn't programmed to think that way. Your brain was programmed to do what they told you to do in school, not to think about what you are doing and why you're doing it and what the implications of your thought processes are. That's why it's called the 180 system. It's the exact opposite of what you were told in school, because we teach you how to think and we teach you how to apply science, which is why you don't understand what's going on when you see me do this. So to answer your questions, yes, I'm pushing harder the second time. Why? Because I have to match her pressure. So the first time I'm pushing 26.6 foot-pounds because I'm matching her pressure. The second time I'm pushing 36.9 foot-pounds because I have to match her pressure. If I don't match her pressure, she's just gonna move all the way up and do a concentric contraction, which is not going to tell me anything here. It's not going to tell me anything about neuromuscular facilitation. So when we do our neuromuscular facilitation test, it's an isometric. I'm matching their pressure. If they can't push and it stutters and gives out, that tells me that muscle's inhibited. I need to reverse the inhibition and then go back and immediately assess that muscle again to see if it's got normal facilitation. So take home message, manual muscle tests don't work. E-stem is unwarranted. There are much better ways to do what you're doing that are based on science that you did not learn in school, that you are not going to learn from a mentor unless they were trained by me, because I have the patent on this, because for some reason I'm the only one that took the time to figure out how to do this stuff, and now I'm teaching it to you. So you can either take this information and say, yes, I want to be an elite physical therapist that does things that make sense and not waste my patients' time and give them real results and get the clutter and confusion out of my head. Or you can say, that doesn't make sense. I'm sticking with the broken medical model. I'm completely happy with being average. I'm completely happy with my patients not getting any real results as long as they feel better, because as a physical therapist, my job is only to help people feel better. And as long as they feel better when they leave, then I did my job, even though they come back with the same problem 2 days later. So make up your mind. Do you want to be elite and break out of the conventional medical model and actually apply the knowledge that you learned in PT school? Or are you happy being average and soon to be burnt out and soon to be selling insurance and not using the information that you spent 7 years and 6 figures to gain? When you're ready to break out of the model, hit me up and I'll get you in the shift.